Hi, everyone. I'm Dr. Swanson alongside Dr. Kubik from KSB Foot and Ankle Center. We're here tonight for KSB's wellness presentation. We'd like to thank KSB Wellness and Aaron Fox for putting this presentation on this evening. And we thought it would be beneficial to talk about bunions and what to do with them. As we start to get warmer weather and increase our activities outside, we may start to have some bunions or bunion pain. And so hopefully we can give you some advice on what to do and help to get you feeling better. So some of the topics we like to cover are what is a bunion? What are some risk factors for developing bunions? What are we looking for on a clinical exam? Signs and symptoms that patients relate to us, and then various treatment options as well. So I'll turn it over to Dr. Kubik at this time.
What is a bunion? I'm sure a lot of people are kind of familiar with the term, but a bunion is a bump that is generally on the inside of the foot. So it's a great toe deformity or that big toe. There are different stages that you can have, and it tends to worsen as that disease progresses or as the staging progresses. So it can start off as a flexible deformity or something that is able to move freely. But as the stages progress, it can become more rigid and with that a little bit more painful. Another form of a bunion is also called a tailor's bunion, but that's more on the outside of the foot. Some associated conditions that can be seen with this are hammer toe deformities or curling of the digits. Sometimes you can see crossing over of the toes as the stages progress. Pain on the ball of the foot as well as some painful calluses that can develop. Some of the risk factors that are associated with bunions or genetics. If your family member has a bunion, some patients will notice that they can also develop that. Shoe gear is a big thing. Tight shoes, especially. We've seen it with high shoes, high-heeled shoes as well. History of trauma or injury to that big toe can also cause a bunion, as well as something called equinus, which is a way of saying tight Achilles tendon. So the Achilles is that big tendon on the back of your heel, and that is the most deforming force of the foot. Having a tight Achilles can cause the foot to kind of roll in a little bit more and can cause a bunion. For a clinical exam, things that we look for is enlargement of that great toe joint, a bony prominence. It can be painful to touch. There might be a little bit of redness associated with that area, usually from rubbing on shoes. Pain with that range of motion. Is that joint hypermobile, or is there increased range of motion in that area? Or like we were talking about earlier, it can also be decreased range of motion, which can also be painful. Sometimes there can be skin breakdown, especially in that bony prominence. And something that we like to look for is calluses over that area, just because the skin over that bony prominence is not very thick, and there's a high chance or a possibility of developing a wound in that area. The hammer toes that are also associated with the deformity. So that big toe kind of acts as a bully. And when it pushes on that second toe, it can cause a crossing over of the two toes. It can cause pain on the top of the toe, as you kind of see in this image here, as well as pain at the very edge of the toe. And again, you can develop calluses or wounds with these.
All right, so some signs and symptoms. So our main indicator for looking at bunions and associated conditions is pain. Is it painful? We can have really severe deformities of toes, but if there's no pain, sometimes we can avoid surgery altogether, which is awesome. The pain can be in multiple areas. It can be in that great toe joint, and that can be due to the bunion or arthritis as well. It could be in that fifth toe joint, as Dr. Kubik mentioned, tailor's bunion on the other side of the foot. Pain with certain shoe wear or certain activities that you do causes an increase in pain. Sometimes you may develop pain under the ball of the foot as well, and that is due to instability of that great toe joint where that bunion is. And when that area isn't functioning properly, it transfers the weight to the ball of the foot, and we can develop issues there as well. So what are some treatment options? Well, conservatively, shoe modifications can be very helpful. White or toe box can accommodate for bunion and hammer toes. And then there's a 3-point shoe test. And so I have my shoe here. I'll show you what I'm talking about. When you take a shoe, any shoe, you bend it like this, it should only bend where your toes bend. So we should not be able to fold it in half. The second test is the sole should be nice and stiff. We shouldn't be able to wring it out like a wash rag. And then the last test is the heel counter. If we push in like this, we should not see it collapse. If a shoe passes those 3 tests, then it's typically a good shoe. We can also add something inside the shoe called an orthotic or an insert. This can be over the counter or a custom insert. Rice therapy or rest, ice, compression, elevation can be helpful. Anti-inflammatory medications. Sometimes bunion splints can be helpful. But as the condition progresses and becomes more rigid, these typically do not help. Steroid injection can also be helpful, and then activity modifications as well. So when we're talking about surgical intervention, what we will first do is take an x-ray or a radiograph. Because what we're going to do is we're going to look at different angles in the foot and also evaluate that great toe joint and see how extensive is the arthritis. If we look at all the different surgical options, if we mixed and matched the various options, there would be over 100. And so we really have dialed these in to a few that work really well. What does a typical bunion procedure involve? Well, the first part is typically removing that bump or enlarged area of bone. We may need to fix it with using plates and screws. The goal of this is to move the metatarsal head or that great toe joint into better alignment. Sometimes we address a joint further down into the midfoot region where the deformity actually originates from. And if there is arthritis in that joint, then typically what we may recommend is a fusion of that great toe joint. That way we're able to fix the bunion and also fix the arthritis. So in conclusion, pain is the main indicator to pursue surgical intervention for bunions, but there are a wide variety of conservative treatment options as well. And what we want to do is we need to find what works best for each individual patient as well. The quicker we can identify these signs and symptoms, then the better the outcome typically is as well. Is there arthritis involvement? Because this can be helpful in the treatment as well. And never underestimate the importance of proper shoe wear and orthotics. And early treatment, like I said, this will keep us on our feet and enjoy the activities that everybody wants to do this summer. So that concludes our presentation this evening. We'd like to thank you again for joining us. If you have any questions or concerns, feel free to leave those in the comments below and we'll get back to you. And if you happen to have a bunion or hammer toe or any foot condition that you would like us to take a look at, we'd be more than happy to see you as well. So we hope everybody has a fun and safe beginning to their warmer weather, and we'll see you next time. Have a great night.